Good morning, welcome to your manual handling training. I'm Jenny Murphy, the manual handling trainer for SASH, and today we're going to look at our beds and the bed controls. In SASH we have approximately 600 standard beds. They look like this, but they should have a blue insert in the head and feet end of the bed, and they also won't have this monitor on here. But all of the rest of the controls are exactly the same. It also raises and lowers to the same level. This is an Axela or a falls bed, and this is the bed that should be used for your falls risk patients. Falls risk patients come in all shapes and sizes, but more likely they will be your elderly patients over 65, possibly suffering with dementia or confusion. They may have had a fall before. They may be somebody who is on 4 or more types of medication, especially if it's something that makes them go to the toilet more frequently or with more urgency. They may have low mood, all of these things, but it's really important that you risk assess whether your patient is a falls risk, and that's documented on your bedside bundle. So to run through the controls, and as I say, these controls are the same whether it is a falls bed or a standard bed. The first thing to note is that down by my feet there is a green light shining on the floor, and this is known as an intelligent night light. And what that tells you is that your bed is at the lowest possible level, which is important so that we know at a visual glance that our patients would be able to hopefully safely get out of bed because the bed is low enough that they can put their feet on the floor. The minute we move the bed upwards, then the light shines orange. If you have the sort of patient that keeps leaning over the side to look at the lights, then you can turn the light off. And you do that using this button here that looks like a light bulb. You would turn it off like that. The rest of the features. It's really, really important that you position your patient carefully in the bed. And what you'll see on the side rails here, on both sides, there is a grey arrow. What that indicates is the position of your patient's hips. So you should position the midpoint of your patient's hips in line with that arrow, because there's a piece of technology in the bed here which, as you sit the bed up, lengthens, and therefore it stops that movement of the patient down the bed, which we used to get before we had these beds with the technology in. It also stops the torso compression that you sometimes get when you sit your patients up. So how do we sit the patients up? Well, there are 2 different methods. The first one, this button here, this is known as the egress button. And what this basically does is that it sits up the head of the bed to enable the patient to get into a seated position. In this way, if you have a patient who can independently get out of bed to go to the toilet but can't sit up themselves, you could show them that button, which is also on the inside of the bed, so that they could independently sit themselves up using the bed controls, therefore enabling the patient to be more independent. So we would sit the patient up using that. These next buttons are to raise and lower the whole bed, the whole of the frame of the bed. If you want to just raise the head or lower the head end of the bed, you can do it with those, or just raise or lower the feet end of the bed like that. One of the best functions on the bed is this button here. This is known as the cardiac or easy chair position. And what that does is that in effect it turns this bed into a chair. And I'll demonstrate that to you now. As you can see, it raises the head end, it puts in a knee brake, and it starts to sit the patient up into a seated position. So what are the benefits of this? Well, it means that your patient is in a better position to eat because they're seated. They're in a better position to drink because, again, they're upright. If they needed a wash, you could give them a bowl on their lap, and if they're able to, they'd be able to wash themselves. Again, we're thinking about enabling our patients to independence. And plus as well, you've probably been in a situation where you have a patient lying in bed calling out for the nurse because they can't see you because they're just looking at the ceiling. Whereas if you sit them up like this, They have a vision of you working on the ward and also the other patients, and they may start to strike up a conversation with the other patients on the ward. Every 2 hours at least, you must adjust the position of your patients in the bed, because we're thinking again about pressure care management. And you can do that using the bed controls itself. So for example, you could lower the head end of the bed, and then down at the feet end of the bed, there is a little metal lever which allows you to lower the end of the bed. And you can do that into 3 different positions. So as you can see, we've adjusted the patient's seated position. It's also important to consider how tall your patient is. Because if you have a patient who's over 1.8 metres tall, 5'11", 6 foot, something like that, you will need to extend the level of the bed because the bed won't be long enough for your patient. To do that, you pull out the handle at the bottom of the bottom end of the bed and pull out the metal portion which extends the bed. Then please move the mattress downwards and put the filler into the head end of the bed. The reason that we say this, especially if your patient is on one of these air mattresses, that this has technology here, it's by density, and therefore this is specifically pressure relieving for feet. And obviously if you move the mattress up, it won't be anywhere near your patient's feet. If you are using an air mattress on these beds, it's really important to consider that the air mattress works by what we call immersion therapy, and therefore it surrounds your patient to make it more comfortable for them. But what that does is that it makes it quite difficult to do manual handling. So we need to use the air mattress controls here to make the air pressure higher in the bed so that it becomes firmer and more easy to do manual handling. So we press this right hand button and this inflates to maximum on this air mattress. In the unlucky event that your patient has a cardiac arrest when sitting in the chair position of the bed, then we need to get the bed down to flat as quickly as possible. And there are 2 methods of doing that. The first one is this CPR button here on the control. And the second method is a manual method. At both sides of the head end of the bed are these yellow handles and it says CPR next to it. What you basically do is pull in the handle and your bed goes down there. And then the electronic function of the bed starts to flatten the legs so that we can get this bed to flat. Please remember that if you are doing CPR, you can't do it on this mattress as it is. So you need to undo this yellow bit of the air mattress, and that will let all of the air out so that you can do CPR just on the phone. So our functions on our screen here, these allow you to set alarms for the bed. So you slide your finger along and that wakes up the monitor, and it now tells you information about the bed. So at the moment it tells us that our bed head end is up at 4 degrees. What we can do is that we can set it to alarm for various functions, and you do so by pressing this little bell button. On the left you have functions where you can get the bed to alarm if the head end of the bed lays down below 30 degrees or 45. This would be used if you had a patient who needed to be sitting up in the bed at either over 30 or over 45 degrees. Perhaps they have a chest infection and the patient keeps putting the bed down to flat to make themselves more comfortable. So you can set one of the alarms to tell you when the bed has gone down to flat. You can also, if necessary, lock out the functions of the bed if this is becoming problematic. And to do so, you hold this padlock button here and then press the functions of the bed that you want to lock out, and you'll notice that they've gone red. And now these functions won't work. In order to turn that function off, do the same in reverse. Press and hold the padlock and press the functions to release them. Most patients will fall when either getting out of bed or going to the toilet. So we have some out of bed functions which we can set alarms on. The first one is the position alarm, and what that does is that it will alarm when your patient changes position. It is very sensitive, however, so it should be used only in those cases where we need to know about our patient moving about in the bed. The second one, the exiting alarm, is very useful. What that does is that it senses when at least half of the weight on the bed moves towards the edge as if the patient was going to be getting out of bed. The third alarm, the out of bed alarm, that will tell you when the weight has completely come off the mattress, i.e. the patient has got out of the bed. However, this is a little bit like shutting the stable door after the horse has bolted, because if your patient is a faller and they've got out of bed, quite possibly they've already fallen over, and the bed will just be alarming to tell you that the patient actually isn't in the bed. The other things that this bed can do is that it can weigh your patient, and you do that using this button here that looks like a weighing scales. What's really important about this is that when you clean down your bed space, before your patient gets into it, with just the linen on the bed, you press this 0 button, because that tells the bed that you only want to weigh the patient. Otherwise, what it does, it will weigh the mattress, the air supply, and anything hanging on the sides of your bed. So 0 the bed, so that it then knows it's just weighing your patient when you get the patient in. If your patient tells you that they're cold and they need an extra blanket, you can put this button, add or remove items. And what you're doing is that you're telling the bed, ignore the item that's just been put on the bed. So we're just weighing the patient. Down at the bottom of the bed, we have a brake alarm. So when we take this brake off, you'll hear that noise, which is the alarm. That only works when the bed is plugged in. So please make sure that if your bed has been somewhere else within the hospital and comes back, that you do then plug the bed back in. Same with the alarms. If you set an alarm and the alarm goes off and you disarm it, it's really important to remember to actually put the alarm back on so it will still make use of those functions. Thank you.